Hey guys, welcome back to The Buzz. I'm Tiara Bree, and today I'm sitting with Dr. Mark Baughman of Coleman Baughman Physical Therapy. How are you doing today?
Doing well. Thanks for having me.
Thank you for coming. So tell me a little bit about your company. How did you and Rob get started?
So Rob and I worked together for quite a while previous to starting our own company, and we both had very similar treatment styles and treatment philosophies. We both had a big passion working with endurance athletes and runners, and so we kind of just started talking how cool it would be to have our own place and some of the frustrations you have with patient care when you don't have your own clinic or your own company. You can't necessarily do it the way you want. So out of both excitement and interest and frustration, that kind of birthed the clinic. And so we've been going strong for about 2 years now and have really enjoyed it.
That's awesome. And what brought you both to Jacksonville?
Actually, UNF brought me to Jacksonville,
Okay.
so I came to Jacksonville in 1997 and been here since, and love Jacksonville, love being part of the community.
Everybody loves Jacksonville. That's awesome. So what things do you specialize in there? You do orthopedic and sports related?
We do physical therapy for orthopedic injuries and sports injuries, and so our niche is working with endurance athletes and doing gait retraining and video analysis of running. But we do treat all orthopedic type injuries from your typical low back pain, neck pain, to sprained ankles.
Okay, and what is the difference between, general orthopedic practicing or, the sports related injuries that they come to you
That's a
for?
great question. Really the big difference is the last phase of rehab, because whether you sprain your knee or hurt your knee with day-to-day life, or whether you hurt your knee in a sport, the first part of your rehab is pretty much the same, but it's that last phase that really differentiates general orthopedic versus sports, because you have to take it to the higher level with the athlete. So that's really the big differentiation.
And is that where the biomechanical running analysis comes in, or is that completely different?
No, that's absolutely where it comes in, particularly if they are a runner, an endurance athlete, where we sit down and go through their whole running analysis. We go through 5 different video views of them, make sure everything looks good from a form perspective, see if there is anything within their form that may be contributing to their injury.
Okay, so form is the thing you focus on, not really, their ability to run.
We'll actually do both.
Okay.
We will, if somebody is not injured, we will absolutely do video analysis just for efficiency standpoint. We don't get into coaching. We actually try and work hand in hand with the coaches and go over and share the video we get with people's coaches to make sure that we really distinguish between coaching and just efficiency. But probably the majority of people we see, we're working on trying to get them back from an injury.
Okay, awesome. And then do you have those connections with the schools to get involved with their coaches, or is that just a case-by-case basis?
It's pretty much a case-by-case basis. We work a lot with First Place Sports and their triathlon team and a lot of their runners. And so that's where we spend a lot of our time working with those guys, and then just throughout the community.
That's awesome.
Yeah.
And then so what things do you see, most common? I know a lot of athletes get injuries, but what type of injuries are the most common?
From a running standpoint, probably the big 3 are high hamstring injuries, IT band syndrome, and plantar fasciitis. The dreaded plantar fasciitis sends quite a few people in. But those are probably the 3 biggest injuries we see from a running standpoint. And then from general orthopedic, low back pain always seems to be a big problem for people.
And then how do you what's your approach to dealing with that, like a low back pain? I wouldn't really know how to start there.
Yeah, that's a good question, and we get asked that all the time. So it really has to be from a thorough evaluation and mechanically just seeing where the problem is. You can't treat low back pain as a diagnosis. You really have to treat some of the impairments or limitations that are causing the low back pain. So you have to start with a thorough evaluation to figure out what's even the pain generator, number 1, and number 2, what are some of the limitations that are causing that to happen. Because very easily, low back pain can be coming simply from the hip, can be coming all the way down the kinetic chain from the ankle, from a leg length discrepancy, and so you really have to find the underlying cause, and that's what directs your treatment.
That's interesting. And do you all have any community involvement or any events coming up?
We do. We try and spend a lot of time in the community. That's a big part of what got us into opening our own clinic as well. We love the Beaches community, and we do as much as we can to be involved. So you will see us out at different races. We'll have tents and booths out at a bunch of races here in town. We have a free injury clinic the 1st and 3rd Saturday of every month. Probably the biggest reason that people don't come in and get checked out is, 1, they don't want to incur the cost. 2, it's not convenient. So we try to eliminate both those things and open up a free injury clinic on Saturday mornings from 11 a.m. to noon.
And where's that located, that clinic?
That clinic is, we do the injury clinic inside our clinic, which is out at Jacksonville Beach. It's 23rd Street South and A1A.
All right. Well, if someone wants to contact you, how could they get in touch?
They can contact us either by phone or email. Phone number is 904-853-5106, or they can contact us at mark@cbptjacksbeach.com or rob@cbptjacksbeach.com.
Well, thank you so much, Dr. Mark, for being here.
Thank you for having me. It's been great.
My pleasure. And thank you all for tuning in. We'll see you next time at The Buzz.